Okay. We're now official. You are seeing your slide, Karen, right?
Yes.
Okay. Welcome everyone to the second half of our School Health Advocacy Learning Session, Part 2. We had a great morning with a lot of discussion around school health advisory councils and also around advocating for tobacco prevention and youth vaping prevention. So we will do a, excuse me, we will do a video posting and send you a link, and we will also send all of the slides as a PDF with all the links that are working as well. So you will be able to go back and use this information. I did get a question from someone offline asking about school health advisory councils and community members. So if you are a community member and you're interested in joining a shack, you have a lot of freedom. You can join one that's close to your home, your neighborhood. You could join one that's close to where you work, somewhere that makes it convenient to you for you to attend meetings. You could even join a couple of school health advisory councils. A lot of times input from community members, or other nonprofits, youth organizations, EverLife Extension, medical community, all of those are welcome additions to shacks. And if you have the capacity to join a shack or even two shacks, it would be great to have you there, I'm sure. So we're going to go ahead and get started. It's 2:01. People are streaming in. I am Michelle Smith. For those of you who might not have been on this morning, I am the Texas State Coordinator for Action for Healthy Kids. And this learning session, this morning and this afternoon, is part of our work in the El Paso community and is funded by Paso del Norte Foundation, Health Foundation, relating to working with schools and districts and parents to improve the school learning environment and make sure that our students are healthy, active, and ready to learn. So this morning we talked about school health advisory councils and advocating for tobacco prevention. This afternoon we have Texas PTA and parenting as advocates, as well as two of our national partners talking about advocating for safe routes to school. So I am going to turn this over to Karen to get us started, and then Kori and Michelle will talk about safe routes after. So take it away, Karen.
Thank you, Michelle. And thank you, everybody, for either coming back from this morning and or joining this afternoon.
Oh, Karen, you're muted all of a sudden.
All right, now can you hear me?
Yes, yeah.
Okay.
That's weird.
I don't know where it muted me, so I'll start over. So just again, I wanted to say thank you for everybody either coming back from this morning session or joining us this afternoon. Just to give you a little brief history, I have background from being a elementary PE teacher to a research coordinator for UT School of Public Health to a district coordinator in Dallas ISD in their health and PE department, where I also was the district co-chair for the shack. I'm currently serving as a director at large on the Texas PTA board, as well as their Healthy Lifestyles liaison. I sort of morphed into Healthy Lifestyles liaison quite a few years ago and recently was elected as a director at large. So all of that experience was prior to me having kids. So my kids, I have a third grader and a first grader. So I like to say that I used to share a lot of parent education resources and tools. And it's obviously changed and tweaked a little bit since my kiddos are actually in school now. But I've had the privilege of seeing the benefits of the PTA and the resources that they can bring to the table. There's obviously other parent organizations, but they are an abundance of resources at the state level that Texas PTA tries to provide for its members and its leaders. So that's just a quick history about me. And now we're going to kind of jump into the PTA history, just to give you a little bit better idea of how health and wellness has actually been at its foundation since its inception. So for 120 years, PTA has worked towards bettering the lives of children in education, health, and safety. It was founded on those three principles. So as you can see here, from back in the early 1900s, where it was, focusing on hygiene, lunch projects, safety belts, and so on. They continue to evolve and support health-related issues, because at the end of the day, that is what our children need to feel safe and secure and be able to come prepared and learn when they're at school. So that was a little snapshot of where PTA has been. And I just kind of want to start with that bigger picture today. You may have gotten a little bit of this earlier in the morning session, but if you're not familiar, this is the whole school, whole community, whole child framework. And it recently was revised a few years ago. It used to be called Coordinated School Health Framework. And I point that out because Texas legislation still calls it coordinated school health. That verbiage is still in place in our legislation. And Texas schools, each district, is required to adopt a coordinated school health program. So you're going to kind of hear and see that language used interchangeably. So the new federal framework expanded. So you can see there's 10 components now, and I'm just going to really quickly go through those. Health education, physical education and physical activity, nutrition environment, and nutrition services. So, not just our cafeteria, but everything else that goes into supporting that nutrition environment. Health services with our nurses, counseling and psychological and social services, our social emotional climate, physical environment. And this is where they actually took two components, or one component rather, and broke them into two. So they have employee wellness now, and then family engagement and community involvement used to be one component and separated out into two. So if you'll go to the next slide. So and I'm just kind of, again, pointing out, I think that spoke volumes when they revised this framework to separate out, you need that community involvement, those community partnerships vested in the health interest within that school district and schools. But again, to separate out that family engagement, I think, again, just shows that there is such a need for parental involvement. And so just really quickly, I wanted to share that the PTA also has national standards for family school partnerships. And there's 3 of them that are specific to advocacy. And I'm focusing on that because that's what we're talking about today. But standard 4 is speaking up for every child. Standard 5 is sharing power. And then standard 6 is collaborating with the community. So again, for almost 100 years, PTA is focused on programs that support children and families and daily lives. And they're going to continue to just expand and grow the support and advocacy that we need for family involvement. All right, so what is PTA doing specifically to support that whole child? That was a big model, lots of moving parts, moving pieces, 10 components. Ideally, you're wanting them to be coordinated, right? And intentionally coordinating their efforts. So where you don't have the parents doing something when the nurse may be doing something in October, but the parents want to do it in September and support. So again, just kind of making those lines of communication more open, knowing what the district programs are that parents can support that and share those messages. So PTA has the Healthy Lifestyles program, it's just about providing education and tools to connect families, schools and community, and then collectively advocate for those supporting healthy changes. So there are resources that Healthy Lifestyles does provide for our PTAs, but it's also, again, taking it to that next level of advocacy as well. And then our Healthy Lifestyles chair, not all states have this as a dedicated position in their PTA, but Texas has that in the bylaws that they can create a Healthy Lifestyles chair. So, and I'm just going to say this up front, you're going to find a lot of your higher functioning PTAs with a lot more membership. They are typically going to have a Healthy Lifestyles chair. A lot of them come in not really knowing what, they may support health and wellness, but they may just want a position on the PTA board to become more involved at their kids' school. So it's going to vary who you get. And then at other schools and PTAs, when parent involvement may not be as robust, a lot of these responsibilities can actually fall under like a VP of programs, other areas within the PTA that aren't specific to Healthy Lifestyles. We work really hard with educating our PTA leaders. And I'm talking like presidents, vice presidents of programs, things like that, positions like that, that they can integrate this in, because again, health was supposed to be at the foundation of PTA. It's not supposed to be one more added thing, just like in our school systems, we're hoping that, they can teach health during a math lesson or a language arts lesson. It's same with our parent involvement. It doesn't have to be this one extra thing. It truly can be integrated into other areas. Next slide. All right. So if you go to the PTA website, Texas PTA, and you go under leader support, so you can see, obviously, they have arts and education, healthy lifestyles, membership, president programs, all those positions. And each position has something called their Basics Healthy Lifestyles Resource Guide. And I'm going to go more into that in this next slide, but that's, again, a very robust resource that we provide for everybody. We also have a dedicated webpage to Healthy Lifestyles. We offer multitude of conference workshops and webinars throughout the year for our PTA leaders. Exhibitors that come to the conference. We have lots of, everything from healthy fundraising to other healthy programs that come and share these great programs at our conference. Online training and webinars, and we have a monthly newsletter that goes out as well. Next slide, please. There you go. Okay, so in our basics resource guide, it's going to have your duties at a glance. And that's just, again, providing that basic snapshot for folks coming in, a sample plan of work. So every Healthy Lifestyles chair, every position on the PTA board is supposed to create a plan of work. It's, pretty much what you think. It's, setting your budgets, that, having your year at a glance goals, making sure they're measurable and attainable. And we give them a sample of what that could look like. What time of year would you implement, a certain program. If you're doing, a kindness week, that might go best in February when it's Random Acts of Kindness week. So we kind of give them those examples. It also has all of this supporting legislation that you've probably heard about. And so anything with SHACs, coordinated school health programs, physical education minutes, things like that. That's all in there so that they can start to educate themselves, because again, a lot of these parents just want to be involved in their kids' school, right? They may not know all of this. And that's what I've truly started to see over the years. And that's where I feel it's workshops like these that help kind of bridge that disconnect of what we need parents to know, because it's, parents are constantly changing and going through, the school system, and there's a lot to know. So we also identify 5 effective strategies that we want them to utilize, as well as monthly national observances. So that way they can kind of view the year at a glance. And so, like I said, we do mention SHACs, wellness policies, coordinated school health mandates, and the whole child model. So in those 5 effective strategies, we break them down into communication, supporting partnerships such as Action for Healthy Kids, participating in programs, And so that could be programs within their school or existing programs out there from other organizations, again, which Action for Healthy Schools has lots of programs that they can participate in. Celebrating our successes. A lot of times we don't give ourselves a pat on the back or, remember to give others. And so we really want them to realize, they think, oh, I didn't do that much this year. And, in truth, they really did a lot and they don't think they did. So we really try to praise those successes. And then lastly is advocacy. And so this can be kind of a scary word for some of these parents who just want to get involved and help do things at their kids' school. But we truly try to educate them so it's not so scary, not so overwhelming. So within each of those strategies, and this is all in that resource guide, you can access it online as well if you're interested, but we give various level of suggestions. So here is some sample strategies, sample examples in the advocacy strategies. So beginner level would just be encouraging parents to familiarize themselves with coordinated school health legislation, right? So again, if this is brand new to you today, there's a lot of parents who didn't even know this was a state mandate. And so this is just one snapshot or example of each. There's a long list in each of those categories. And so advanced is approaching your school wellness team or administration about creating improved campus policies. So this could be, okay, we've worked with the school a little bit. We've got some programs going on. Now maybe I want to take this to the next level. This could be, not doing birthday celebrations and extra recess in lieu of that. I've seen schools say, we don't want you bringing in outside lunches. We want you to come eat in the cafeteria. So, you're just kind of scaling down on McDonald's and stuff like that coming into the school, but it can be a variety of things, but that's really sort of, Healthy Lifestyle has been up and running for a while. You've got that school administration support and parental support. So that intermediate level, one of the suggestions in intermediate is stepping out to serve on your district SHAC. We list this as intermediate for parents because it is an added layer of commitment, right? So they're already going to their local PTA meetings or board meetings. And then this is a full separate, committee at the district level. It's going to be a separate time, extra meetings. So we do tend to suggest that, they give it some time before they join in. Another good suggestion is if you have a PTA council within your area. So most larger cities, if they have PTAs, they are going to have a council at that city level. And they then can share resources out to all the local elementaries and middle schools and high schools. This is another really good person to try to get on the SHAC. So if they're not involved, you can definitely just, kind of search your town's name. And if that, that council PTA and see if that pops up. And then just, kind of start the dialogue and conversation. Do you have a Healthy Lifestyles chair at the council level? Not all of them do, but if they do, are you serving on the district SHAC? Again, these are volunteers, all volunteers. So they may not know, they may be trying to do a lot of wonderful things. It's just, there's so many things to know and do. So we do definitely list that as an intermediate step for them to join on the SHAC rather. Okay, so again, just diving a little deeper into the background of PTA advocacy because it was founded on that as well. So, we deal with family engagement, parent education, and advocacy are the three main pillars that PTA provides resources for. And so if you go on the website, they've got a whole section dedicated to advocacy. So as many of the supporting organizations out there, they're going to have ways to contact your legislature. So you can sign up for alerts, you can find legislation, who to contact, who's your elected official. They also now have Child Advocate Awards. And so they recognize outstanding advocates at the local, council, and student level who are truly trying to enhance public education. Then they have sections for local advocacy and state advocacy. There is a resource guide for a toolkit rather for local advocacy, launching forums and such with your school board. And then our state advocacy, they have a robust set of resolutions and legislative priorities that they establish and set and review every 2 years with the legislation. And the difference between our resolutions are more of a call for action, right? So this is a written, more robust call for action by Texas PTA. And then our legislative priorities are outlining opinions or intent of the association. And so those are the two differences of what they actually outline in our state advocacy. PTA votes is another way that you can check on date reminders, voter registration, voting locations. They also have Rally Day. That's not on right now, the website, but when it comes time for Rally Day, they do put that on there. And that is every February during a legislative session. So every 2 years, Texas PTA brings in, they invite everybody, PTA members to come to the Capitol. It's a very meaningful and inspirational event where we have speakers, and then we go march, to the steps of the Capitol, and we rally there. And we encourage our PTA members to set appointments with their local constituents and meet with them at the Capitol and talk about the priorities that, everything from surrounding public education to, budgeting to health and wellness, right? And then also there is Straight Talk, which is opposite years of legislation, and they host a panel discussion of timely topics. So for example, in the past, they've hosted one on vaping, and just this past February, it was Dare to Self-Care, and again, more focusing on mental health. So just again, trying to show you that there are a lot of resources out there for parents. It's just trying to get them to know what's out there and how they can utilize it. So I mentioned the resolutions and priorities earlier, and I just wanted to give you a quick snapshot of our 2021s. The resolutions were for reduction in childhood obesity, safe schools, playground safety, recess, and summer food service. Some of them stay constant and stay on there. Some of them roll off and they put new ones on. And then there was just too many to even put on this slide, but just a variety of health, welfare, and safety issues for our legislative priorities this past session. And this is just a quick snapshot to show the parallel advocacy efforts at national PTA. So they have a lot of the same tools, ways to take action, more federal legislation, obviously. They do offer a legislative conference and PTA position statements, very similar to those resolutions and legislative priorities. So just again, lots of additional resources there with national PTA. All right, so I know y'all kind of talked about this morning. So if this might, you might remember this, and if you're just joining in, there is a difference, between advocacy and lobbying. So while lobbying is advocacy, not all advocacy is lobbying, right? Advocacy is the action that speaks in favor of, recommends, or argues for a cause, supports or defends, or pleads on behalf of others. It can also include public education, regulatory work, litigation, and work before administrative bodies, lobbying, nonpartisan voter registration, and more. So basically, in short, advocacy or advocating for your mission encompasses just about every form of communication that a nonprofit can do. Lobbying, on the other hand, is a little bit more narrow. So it's communicating with decision makers, specifically elected officials and staff, voters on the ballot measures about existing or potential legislation. And it's urging a vote for or against. So that's more lobbying, right? And all three components of this definition are required: decision makers, actual legislation, and asking for a vote. So we are definitely not asking parents or anybody here to start lobbying. Advocacy is on that different level, right? So remember, not lobbying is advocacy, but not all advocacy is lobbying. All right. So, talking about educating parents, like I said, I've been doing this from a PE teacher standpoint to a district coordinator to now actually being that parent, and it's definitely ebbed and flowed. So I think just, those kind of hitting those key factors when we're trying to educate parents, not overwhelm them. Trust me, I've got friends in our neighborhood that, I start talking to them and their eyes glaze over because it's too much sometimes. They've got a lot of things on their plate, a lot of other different responsibilities. And so it's just kind of keeping it simple, right? Why? Why is there a need for school wellness initiatives? We may have always offered, cotton candy and all the things at the school carnival, and that's fine. We're not asking you to take that away, but why do we need wellness initiatives at school? So first and foremost, kids are spending a majority of their time at school. And we have some of the most alarming statistics with everything from obesity issues to mental health issues targeting our youth right now. And so there is a need for it at the school level, and for parents to understand what's going on at school and how they can support it at home. There's also that, like I mentioned, state and federal legislation, mandates that are in place, research and best practices as well. So just kind of, remembering to say, look, you don't think it's maybe as bad here, but we do have some data to show, or this is some local data from our city or from our county. So kind of painting that picture that there is an issue out there that we need to address. And then comes down to the what. So what is in place. So again, reminding them, we have that whole child framework. It's again, intentionally trying to coordinate all those areas together. Required mandates. We also have required local school wellness policies. We have state approved coordinated school health resources. And then we are required to have a school health advisory council at every district. So we've got lots of great things in place of how to support. And so how do they do it? First and foremost, we say be an advocate, right, for health and wellness, just supporting what's going on at your local school, finding out what's going on at the district level and supporting that. A lot of the times new folks who join on our shack, they'll give a district report and they're like, oh, I had no idea that our district was doing that. And so it's just truly advocating them to help spread that word. Communication. And then just serving on your, not just your shack, but again, if you are in that healthy lifestyles chair position, really utilizing that wellness team on your campus, which could be your PE teacher, your nurse, your counselor, maybe a grade level rep. We've got two of our fifth grade teachers right now who have kind of been more involved because we started a grant I'll talk a little bit more about later, but with hydroponic gardens. So they're now kind of getting more invested. So you kind of start small and kind of, continue to grow that wellness team to help communicate that message. All right, so what is a shack? Again, some of this might have been covered this morning, so it may be a little bit of a review for you. But again, a shack is a district level advisory council. So it has to be a majority parents, okay? 50% is required to be parents. Should be, right? I use the word should a lot. Oftentimes you don't see that percentage, but that's, a challenge for a lot of districts that they are continuously trying to work on. Each year they must meet a minimum of 4 times. And so they can choose that, like this past year, we did a little bit of Zoom, virtual, and then some in person. I'm hoping we get back to more in person because that truly is where the, conversations and communication can happen. Advisory district council with varied representation. So you do want some district representatives, community representatives, as well as those parents. They leverage support with a required annual board report. So they are required to submit their board recommendations with citing, any research and best practices that they've researched over the year. That's not saying that the board has to adopt those recommendations, but they have to produce that yearly report. Texas law does require one for every school district, not campus. They can have that campus wellness team, but a SHAC is required at the district level, just to reiterate. And then they basically cover all things health recommendations, right? So it started as primarily looking at human growth and sexuality curriculum way back in the day, that was the main focus of this council. And it truly has expanded to such a, anything and all things health related, with it's looking at new, health textbooks or recess policy, reviewing the district wellness policy. So it's really grown and evolved over the years. All right, so why is it important? I'm not going to sit here and read all this, but it provides that voice. It gives parents that, local voice that they can, advocate for, what's going on at their school, and then pass that message along to the district. And it can differ from grade level to grade level, right? So what's going on at the elementary is not going to be the needs at the high school, obviously. Advocate for solutions in your community. So again, what's going to work best in Richardson ISD is not going to work best at the small town I grew up in outside of Corpus, right? A more rural, tiny town versus a bigger, larger city. So really looking at those individualized needs of the district. And then supporting school administrators. Again, as a district coordinator, we would have, 60 new principals every year in Dallas ISD that we would sort of have to give the same song and dance to educate them, because they are learning and just, thrown so much stuff at them. It's trying to just merely educate them, because sometimes they don't know what they don't know, right? And then lastly, providing resources of expertise on a variety of health topics. Again, this is critical when you have that varied representation. So, you've got nonprofits serving on it, perhaps, a hospital. I remember we had a natural grocery store representative who wanted to serve. So again, all of those backgrounds can bring you that really robust expertise to give you, mindful recommendations when you're coming forward to the board. All right. I know we've kind of talked about this already, but who should be on it? 50% parents. Again, you can see just a snapshot here of all those other areas that can be included. And then what do SHACs do? So per the Department of State Health Services, they have a resource guide that sort of outlines what are the main things that SHACs should do. And it includes, looking at the program planning, what the district is doing, recommending new programs, promotion of existing ones, and looking at that fiscal impact. How is the district spending the allocated funds for a health-based program, right? And is it worthwhile? Collaborating with district and state agencies, and, again, looking what you have in your local community to support that as well. Liaising with the district board. And I'll give another example of that here in a little bit. And then just, again, looking at the evaluation, accountability, and quality control, is the district doing what they're saying they're doing, and kind of just making sure that, that things are being covered the way they say they are. Excuse me. And then lastly, just how do SHACs help? So review and revise district wellness policies, addressing issues in student health. And I've already said this multiple times. So research best practices and researching, because again, you do have a lot of parents, coming in, and maybe they read a blog and they think, oh, I want to try this. But if you can go to your board with very evidence-based programs that are reputable, then it's more likely that that recommendation is going to happen versus, just something that was willy-nilly. But over the years, they, as part of Dallas ISD, sorry, I was looking at my notes a little bit, I was involved in a variety of things, such as reviewing and expanding the wellness policy. So that now has to be reviewed every 3 years. And so your district should be on top of that, but just, again, knowing like, okay, when was the last time this was reviewed? So it used to be a biannual thing every 2 years, and now it's every 3 years. I also helped Dallas ISD in growing our subcommittees to provide those evidence-based recommendations. And so you have to have a physical activity subcommittee per state mandates, but there's no limit on what a district can have as far as other subcommittees. So we really, we slowly grew the amount of subcommittees. And again, that gives those parents involved a little bit more ownership and vested interest in something that they're more geared towards. We had one that was in human resources elsewhere, and she really wanted to serve on our staff wellness subcommittee and see how better we can support the teachers, right? Because if they're not invested in this and they don't feel like they're healthy, they're not going to want to communicate these messages to the kids. So truly staff wellness is a big, big piece of the puzzle as well. And she was very invested in that subcommittee. Also, just reviewing district data. We had somebody from UT School of Public Health, UT Southwestern on our subcommittee, who was just all about the data. And she wanted to look and see, what the district was collecting. How was it, changing with student obesity rates and things like that. So, that's another area that your SHAC can oversee. One other thing that we did in Dallas ISD was implementing a new human growth and sexuality curriculum. Many of you probably know this is a very, very strong a subject that has a lot of opinions. And so, it's doing the most due diligence to research the programs that are going to work best for your district. And that took a long time. So we spent a better part of 2 years looking at that. And the same for our recess policy. I still remember when our SHAC was a lot smaller, we went in with, our first board recommendation for a recess policy, and it got, kicked back to us. I just saw a topic, very controversial topic and challenging for many SHACs, 100% agree. But recess not as controversial, but it got kicked back because we said, the district shall require recess for 20 minutes. And it got kicked back saying can provide recess, and they didn't allocate a time. So that was our first iteration. And then it took multiple more iterations. And again, some of our SHAC members working with one of the board members they were a constituent of, and finding out that he truly supported recess. And so once we had that board relationship and knowing that, the parents had that direct line and support from him, he worked with the district to finally get a very robust recess policy requiring a certain amount of minutes, not allowing kids to be pulled for disciplinary issues. So again, what started off as a tiny policy continue to grow and expand. And that's what we, try to tell people. This is not a one and done. You serve on the SHAC for a year and it's over. And all these miraculous things happen. It does take time, but there's so many ways and so many areas that they can impact. All right. This is a little old, but TEA, which is our Texas Education Agency, sends out a school health survey every year for district coordinators to submit. A lot of it is, what programs are they using and who's serving on their SHAC and such. They no longer ask the question about if there are PTA members. They do ask similar ones, but not specific to PTA. I think it's more community questions. But at the time, you could see at the very bottom, PTA representation was very minimal. And so this is where, we're constantly challenging our PTA members to, hey, let's try to, get to that intermediate level, take it to the next step. So where you can serve on your district as well. All right, I'm going to probably point out some things maybe that Michelle did this morning, but again, it never hurts to see it because again, we all kind of work together, right? So PTA is going to promote a lot of these resources. Hopefully, they're going to again promote what the PTA can do for them. So who do you go to for additional resources outside PTA? Next slide. Obviously start with the Department of State Health Services. They're going to have your SHAC resource guide on there. United States Department of Agriculture has information for our wellness policy, as well as does Action for Healthy Kids and other resources as well. Yes, more slides with resources. This is a snapshot from the Department of State Health Services SHAC guide. So very upfront, when you click on that guide and you open it up, they give you this list of resources of all these great organizations and agencies and nonprofits that can support you. In that guide, they also have planning guidelines, and they have some sample documents that your SHACs can use. As well as supporting legislation, sample bylaws, and then they also oversee the TSHAC. So next slide, Michelle. So the TSHAC is the Texas School Health Advisory Council, and they work hand in hand with DSHS to support coordinated school health programs and school health services. And so they also have a lot of resources on their website. And this is one of my favorites, just sample meeting agenda topics. So you can see some of them are hyperlinked and some aren't, but again, gives those SHACs sort of, a starting point of, okay, what are some things we want to focus on? What are some ideas that we want to look at this year? And then they also have a SHAC self-assessment as well. As is Action for Healthy Kids. We love supporting them because I do feel Action for Healthy Kids does a great job in streamlining a lot of those resources and kind of being that dot connector to put all these things in place. Already we know they host wonderful webinars all year long. They have grants, opportunities for grants, and just great support. They have their resource library. They have Game On. They have Every Kid Healthy Week. So lots of great resources already there. Another cool thing that they offer, because again, when you're looking at assessing and where you want to prioritize your needs, they have a modified school health index. And so if I'm not sure if Michelle covered this morning, but the school health index helps you just, look and gauge where your school's at. And they have it again categorized out and limited, for elementary, middle school, and high school. And then newly, they have started the Texas School Health Advisory Council Network. So new, and you're going to find SHAC laws, wellness policies, surveys, and more. So again, we want to just help people point them into that, one-stop shopping, so that they can, find those resources, because a lot of times, they get, searching in all these different directions, and a lot of great resources out there, but we want to kind of keep them honed in. And this is just a sample flyer that was recently released, and from the Texas School Health Network. So again, more resources to come. And again, trying to just kind of keep it simple. What is it? Why do we need it? What's your next step? So you don't have to listen to a whole webinar all over again. It's, you got some great resources there to just kind of consolidate it. All right. And then lastly, my suggestion is going to be just look into other school districts. So if your district does not have a very robust SHAC, and they're, y'all are kind of either invigorating it, or you're just kind of starting up, there are some great district SHACs out there. So go ahead and go to the next slide. So again, finding out some of these SHACs, there's, and I'm going to, my next slide will go to an organization where you can find SHAC winners from awards in the past, but this is an example of Fort Bend ISD, which has been an award recipient SHAC. And you can see on there, they're going to have everything posted from, their meeting agendas and minutes and slides and subcommittee reports, all that's posted. Now, not all districts have all of this on there, but finding some of those higher functioning SHACs to look and say, oh, I like the way they did that, right? And so just kind of, having it snowball from there. But again, the districts hopefully are going to have their annual report to the board, meeting minutes from what they have covered. They now, with new legislation, have some new requirements for posting audio of those minutes as well as whatever recommendations they made, and recruitment as well. Some districts start recruiting now. They may be reaching out to principals to say, hey, we're recruiting now for September. Do you have a parent from your school, you would recommend? Or to the board members, do you have, one of your constituents that you would recommend as a, a great asset for our SHAC? So If they're not recruiting now, you may simply just reach out to them because they kind of hit the ground running in September. So they want to have all, as many parents recruited as possible to start, in September as quickly as possible. All right, so because I kind of jumped forward on this one, It's Time Texas, they're not currently doing these SHAC awards anymore, but if you go to their website and you look under past SHAC award recipients, and you can see them from all the previous years. So then you could possibly go to that, district's website, check them out a little bit more. And on their website, they do have some success stories. And this, I just wanted to share a simple one, or a quick one rather, from Huffman ISD. So 2 main things that they had done that year were created parent-to-parent meetings hosted by the SHAC members, but with mental health providers that were speaking about signs and symptoms and solutions to mental health issues. So they were really, again, trying to bridge that gap or that disconnect from the district, and having these SHAC members like, here are the parents within your community. Let us help get other parents in, but utilizing these mental health providers or district coordinators' expertise to help, guide these discussions. But again, it was something that their SHAC initiated and wanted to just, continue momentum over the year. And then they also researched and voted to adopt a curriculum called Catch My Breath, which targets youth vaping and cigarettes. And so they approved that curriculum within their district. So those were just 2 of the things that their SHACs had done that year, some very robust things, researching and implementing. So go ahead and go to the next slide, Michelle. So these are just some others of just in general, multiple SHACs that they've done from where they've evaluated and explored culture and safety. So for example, one, they reviewed and approved the Sandy Hook Promise program, and which definitely looks at, the safety of a school, and then supporting staff wellness. We talked about that earlier. And so this particular district had worked with their athletic department to provide all staff free access to workout facilities, which I think is huge, because again, if you're giving those teachers more opportunities to be healthy, the more buy-in that you're going to have from them. And then other policies and initiatives. So that could be, again, SHACs helping, get, the board to adopt a policy on recess or other movement-based promotions district-wide. And I put such as Walk Across Texas on there. That's a program through Ag Life Extension, but that's again, something that a district may not be aware of. And hey, this is a way we can promote movement throughout our schools. It could be a district-wide initiative. And, then it becomes a little bit more systemic and more self-sustaining within the district from year to year to kind of build on that momentum. And then, hold on, let's see. I also just wanted to talk go back to well, it doesn't matter, Michelle, just at the local level, going back to those other district accomplishments. This is with so I serve on the Richardson ISD SHAC now as a parent, because that's where my children are. And we wrote a grant, our PTA wrote a grant for our local school, and our SHAC is now very interested in it because we looked at putting hydroponic gardens in, because our principal, we were kind of tiptoeing into that whole outdoor classroom environment, and that takes obviously more funding. And so our principal liked the idea of these hydroponic gardens to start. So we're experimenting with that. And then we also wrote in to have these like giant life-size stencils. And those aren't cheap. And so part of our grant was covering these stencils, like a big Connect Four and a big tic-tac-toe and hopscotch and things like that. So our SHAC's very interested. So it's kind of utilizing even at that local level and piloting it at certain schools of what can then be mirrored and expanded on at the district level. So I just kind of wanted to give a little brief overview, at our local level. And so then lastly, but not least, I know I mentioned it earlier that PTA has a Healthy Lifestyles newsletter, and we try to always highlight a local success story, and so that you can garner ideas from other PTAs. We also have monthly tips, calendar coordination tied to those national monthly observances, funding and freebies. So whenever there is a grant out there, I think you can see at the bottom, that was back when Action for Healthy Kids had a grant coming out. So we try to promote that. And then advocacy updates as well. So we definitely try to cover each other's bases and promote within, and let our members know that there's a lot of resources out there for them, hopefully not overwhelming them. And that is it. That was kind of fast and furious. But again, I do thank you so much for all who are on here today and for advocating for health and wellness in either at your local school level, at the district level as a SHAC. But I encourage you, if you're, not on the PTA, go join, find out if they have that Healthy Lifestyles chair and how else you can help from there. But thank you for all that y'all are doing.
We do have a couple of questions.
Okie dokie.
So the resources you were showing up in the beginning, do you have to be a member, have a number to sign in and look at the Healthy Lifestyles resources?
Currently, you do not. It used to be sort of password protected, but right now it is accessible to anybody. So you can go on and check it out.
Not promoting not joining PTA, but
no, exactly.
We may have some community members. I mean, we have some SHAC community members that really aren't in a position to be PTA members unless they joined individually, I guess.
Right.
So it would be nice if they could see that. Do you have any idea what the legislative priorities are going to be for the next legislative session?
Great question. We will probably start looking at those this summer. So we don't at this current moment. Those have not been established yet.
I will mention there's a group called the Partnership for Healthy Texas.
Yeah.
And we also focus on child obesity legislation and have, worked on recess and physical activity and SHACs. It's another group that we're working on our legislative priorities. We have a meeting in May and should have some information on what that's going to look like. So if you're interested, I can add that to our follow-up email. And then another question, do school districts choose if they have a PTO or a PTA, or is it a campus level decision?
Typically, it's going to go through the district level. So, we have upper level staff support that is there to go help talk to your superintendent of, why a PTA is such a great resource, because there are added layers that a PTA can offer. So yeah, that is done more at the district level though.
Okay. Any other questions out there before we sign off and move to our next and final session for today? Karen, thank you so much. PTA has been a great partner. We have, they have a large group of advocates. And, when I was a member of PTA when my kids were growing up, I was always surprised at how much of their work did involve advocacy. A lot of people think PTA just does,
fundraising and
really that's not the case. And I know in El Paso, they have some strong PTA and we have worked with them in their capacity down there. So that is a great resource for SHAC members, getting the PTA councils to identify their PTA parents that could be part of a SHAC that are interested in health topics. So there's a lot of value in affiliating with PTAs if they are in your school district. So
yep.
Thank
and
you.
Then like you said, if not, definitely just, even hop on and go check out some of the resources, it's there. We just, we want to help. So, but thank you again for having us on as well, Michelle.
Thanks. All right. I'm going to invite Michelle and Kori to join us. Our last session is Safe Routes to School, and our work, I'm going to let them take over the share. Our work in El Paso has allowed us to forge a strong relationship with our National Safe Routes program and work to find ways to make it safe for children to walk and bike and roll to school. So we're excited to have two of our national partners members with us today to share their resources and their advice on advocating for safe route to school programs. So Michelle and Kori, I am going to turn it over to you.
Thanks for the introduction, Michelle, and thanks so much for having us. Good afternoon, everyone. My name is Kori Johnson with Safe Routes Partnership. I'll be presenting with my colleague, Michelle Lieberman, and we're here to talk about building a Safe Routes to School program in your school. So I think that Karen gave a really nice introduction and overview of different advocacy efforts, what advocacy looks like, some best practices, and then some local things you can get involved in Texas. And Michelle and I are really going to hone in on Safe Routes to School as one of those advocacy issues you can explore when thinking about working in your own community. So just a bit about our organization. If you've never heard of Safe Routes Partnership before, we're a national nonprofit, and we work to advance safe walking and rolling to everyday places, including schools and everyday life, and improving the health and well-being of people of all races, income levels, and abilities, and building healthy, thriving communities for everyone. So we do work nationally. We've done a bit of work in Texas recently, including El Paso and Houston, Baytown. So we're excited to be speaking to all of you today. As I mentioned, I'm Kori Johnson. I'm the Program Support Manager here at Safe Routes Partnership. I'm based in Washington, D.C. And my colleague, Michelle Lieberman, is also joining me, and she's our Consulting and Program Support Director, and she is based in Orange County, California. So just a bit of what we're going to cover today. We want to talk a bit about Safe Routes to School in general, just what it is, kind of a, Safe Routes to School 101 session, and then talk a bit more about Safe Routes to School advocacy and things that you all can do as advocates to advance Safe Routes to School, including connecting with decision makers, building a coalition of support, and then crafting a message around why Safe Routes to School is important. Then we'll talk a bit about Safe Routes to School policy, and we'll also leave some time for Q&A at the end, and you're also welcome to drop questions in the chat box throughout the presentation. So I wanted to start out with a quick poll. Let's see if I can launch this. So we would like to hear from you all about how you got to school growing up. So the poll should be launched and out there. Feel free to go ahead and drop your answers in. We'll keep it open for 30 seconds. Okay, a lot of walking. Interesting. Okay. All right, so I'll go ahead and end this and share the results. So it seems like a lot of people walk to school, growing up. A few people took public transit, driven by a parent. I forgot to have the school bus option on here, but I'm sure that there's some people who probably took, yellow school bus to school. And then a few people biked. Okay, and then our next question is, let's see. How familiar are you with Safe Routes to School? So I don't know if any of you have heard about the program before, participated in any Safe Routes to School events, maybe a walk to school day, bike to school day event. We just love to get a sense from you all about what you've heard about Safe Routes to School. I'll keep this open for a few more seconds. All right, and I'll go ahead and close this out. Okay, so a nice mix. So some people who've heard of Safe Routes before, some people who might have heard a few things but aren't familiar, and some people who are kind of new to Safe Routes to School. So I think this session will kind of have something for everyone, depending on if you're familiar with this program or just learning about it for the first time. Thanks for answering in the chat. So just a bit of background information about what Safe Routes to School is. And this actually relates a lot to the question that I asked in our poll about how did you get to school, growing up. So Safe Routes to School is a movement and a program to make school travel, including walking, biking, rolling, so even things like scooters and skateboards, safer, more convenient, and fun for children of all genders, races, and abilities. It's an opportunity for different community members, so school staff, students, families, local advocates to come together to really advance safe walking and rolling and making sure that that students have a safe travel route both to school and also home from school. It's been active in the States for about 15 years, probably more than that at this point. And there are Safe Routes to School programs that are run in communities all across the country. Some are really, small, school-based or county-based, all the way to programs that are managed in, large cities. So one reason why I asked about how you got to school when you were growing up is because, in 1969, nearly 50% of children walked and biked to school. And today, just 13% walk and bike to school. And there are a whole host of reasons for why that shift has happened. Everything just from, being a more car-centric, society, to the way that we design our neighborhoods, to school choice, having students who are going to, school outside of their in-boundary school zone. But the decrease in students walking and biking to school is definitely something that is an area of concern, both just from a physical activity standpoint, but also even from, a community connectedness and social cohesion point as well. So a few of the concerns related to, safe routes to school and, less students walking and biking. A third of children are overweight or obese, triple the rate of a generation ago. Family car trips make up a lot of morning congestion traffic. I'm sure that there are a lot of you who may have experienced that, especially with the school bus shortages that were happening as a result of the pandemic. Just a lot of, congestion during drop-off and pickup times. Motor vehicle injuries are the biggest source of fatalities for children, whether as passengers or on foot or on a bicycle. And these injuries and fatalities are especially high in low-income neighborhoods. So, like I just mentioned, safe school travel is definitely a key issue that continues to, to be one. And so we found that Safe Routes to School is one of the solutions in, kind of tackling some of these issues and concerns. So Safe Routes to School programs increase walking and biking by 35 to 45%. And can also decrease pedestrian injuries near a school by 45 to 75%. And kids who walk and bike to school are shown to be more physically active, fitter, and have lower BMIs than kids who don't. So Safe Routes to School programs definitely offer a lot of benefits, and it's just one solution to some of the issues and concerns that people have around students walking and biking to school. So a few benefits of Safe Routes to School. There are many, so it kind of seems like there's a benefit or something in Safe Routes to School for everyone. I mentioned some of them before, but a few others, community connectedness. So just being able to go and walk to school with your friends, kind of build those relationships through walking and biking and rolling is a great way for people to connect to each other. And again, especially now coming after a time when people had to be, isolated, kind of getting back to reconnecting with our community is really important. There are also a lot of climate benefits, fewer student asthma attacks due to less driving and reduced air pollution. So less air pollution from, traffic, car congestion, less air pollution from school buses, and just having cleaner air around school zones is really important. Another benefit is better academic performance. So just, having students who are, better focused, improved concentration, and less distracted if they're, walking or rolling to school. And also fewer absences and less tardiness if there are students who are walking or biking to school in groups. There are also traffic safety benefits. Less cars on the road means less opportunities for people to, get hit, for those traffic injuries or fatalities, and also more chances for students to learn about the, road safety. So how to cross the sidewalk safely, what the different, street and road signs mean. There's also an educational component of Safe Routes to School. Other benefits include safety from crime, school transportation fixes, so not having to spend a lot of money on school buses, being able to have students walk or bike to school instead. So there are both cost savings for, on the school district end and also, on a household end too, not having to spend money for, gas, which would be great these days because gas is really expensive, and, possibly being able to use those funds to serve students in a different way. And then lastly, just healthier students. That's always a great benefit. So, students who have, stronger bones and muscles and joints, and also reducing some of those risks for chronic disease, diabetes, and obesity. So lots of safe routes to school benefits for communities to enjoy. So there are a few different ways that Safe Routes to School programs can be organized. There are so many different models, and it's really about picking the one that is best for, for your community and your context. So at a local level, Safe Routes to School programs are organized by, cities, counties, schools, school districts, or even community organizations. So a program can serve, anywhere from one school to a cohort of schools to, a whole city of schools, depending on how the program is structured. At the state level, Safe Routes to School programs are usually administered by a state Department of Transportation. In Texas, it would be TxDOT. And so that larger managing body would provide resources to support the local programs. So there might be a larger statewide management, and then each individual city or county or school district could get resources from the state to help run their local program. So thinking about Safe Routes to School from an advocacy lens, and about some things that you might be advocating for when thinking about safe routes and school travel. You might be advocating for things like, street, sidewalk, and crosswalk improvements. There are some communities where kids don't walk to school because there are no sidewalks, or because there aren't painted crosswalks, or because there's just no, safe path to school. So those infrastructure improvements might be something that might be on your advocacy list. Improvements to other places along school routes. So schools are often located close to parks or recreation centers or libraries. So when we think about safe routes to school, schools often serve lots of different purposes and functions beyond just a place for students to learn. It's a place for community gatherings, for for sports events. So you might be advocating for improvements to other places that are located near schools. Bike education is a big one. There are a lot of students who like or would like to bike to school. So part of Safe Routes to School is also providing those bike skills training courses, how to ride a bike, how to put on a helmet, what the different bike signals mean. You might want something like that, as a way to encourage more walking and biking. Obviously, if you know how to ride a bike and know how to do it safely, then you'll be more inclined to bike to school or let your child bike to school. You can also advocate for Safe Routes to School funding for projects and programs. So, you might want to get a fleet of bikes for your school to, so students can learn how to ride, or educational assemblies around Safe Routes to School. So advocating for funding. Safe Routes to School policy. So there are some communities that put Safe Routes to School into their, district or county or city policies, whether it's a wellness policy or a policy around where schools will be sited. So, having a school located in a neighborhood as opposed to a place that's not walkable or bikeable. So that might be an advocacy angle you want to take. And then also just things that are, pretty like practical, logistical things that'll help schools function better. So having a safer drop off and pickup procedure, having more crossing guards. I know, again, these are issues we've talked about a lot recently, which is with a lot of the some of the chaos that's been involved in drop off and pickup, and all the traffic congestion, and just trying to reduce some of the concerns around those kind of peak school travel times. So when thinking about advocating for safe routes to school, it's really important to know, who are the decision makers, who are you advocating to, and then who runs safe routes to school. So if you want a safe routes to school program in your community, or if you want more crossing guards, or if you want a policy around drop off and pickup, or if you want dedicated funding for safe routes to school, who should you talk to? Who are the people who, are in the position to make those decisions? So if you're thinking about something like infrastructure improvements, right? So like an improvement to a sidewalk or a street, constructing a new sidewalk, filling a sidewalk gap, fixing a sidewalk, fixing a crosswalk, you'll probably be talking to a city or county staff member, maybe somebody working in transportation or public works, maybe even a city council or a county board member. And then for larger projects like a state highway project, let's say, you'd probably go to the state DOT to talk about those improvements. Not all Safe Routes to School programs focus on infrastructure. Some also focus on education and encouragement programs. So just activities and events that both teach kids about safe walking and biking, but also kind of drum up that enthusiasm and excitement about walking and biking. So something like a walk to school day or a bike and roll to school day, or having a bike skills course as a part of PE. For those types of programs, you will probably want to be talking to school leadership, so school administration or school district leadership. So superintendent, school board members who are who might have more decision-making power over curriculum or school activities. When thinking about advocating for safe routes to school funding, you'll probably be thinking about talking to, again, a city council or board, even a school board, a metropolitan planning organization or an MPO, even a regional transportation planning organization or agency, and then also your state DOT. So depending on the scale of the project that you're trying to get funding for, that'll probably determine who the best person would be to talk to. And then lastly, if you're thinking about adopting a safe routes to school policy. So again, this can be done on, on a school level. So just what's a policy that can be put in place at an individual school. It could be for a school district, it could be for a city or a county. So in that case, you're probably going to, have to get in touch with a school board for a district policy, or a city council or a county board for city and county policies. I'm just going to stop for a moment and see if there are any questions.
I don't have any yet.
Okay, great. So I'm just going to keep on going. All right, so next we wanted to talk a bit about making the case for safe routes to school, right? So let's say you learn about safe routes to school, you know that you want safe routes to school, in your community, whether that's in your individual school or your school district, or maybe you already have a program and you want to expand it or get more funding or add something else to the program that's missing. How can you make the case for saying that safe routes to school is important and that this is something that we should, invest our time and energy and money into? So the first thing you need to do is connect with your local decision makers and figure out what their interests and priorities are. I'm sure that anybody who's tried to advocate for something or convince somebody of something, oftentimes you have to find the thing that that person is interested in, right? What do they care about? What are their priorities? And kind of use that to increase buy-in. So it's helpful to think about some common motivators. Why might somebody care about safe routes to school? And, this infographic is just the same benefits that I went over a little while ago. So that, those same, benefits of safe routes to school are also common motivators for people. So who cares about traffic safety? Who cares about community connectedness? Who cares about, the budget? Or from a health angle, who cares about having healthy, healthy students? So it's really thinking about what different stakeholders are motivated by, and then using their motivations to, to advocate for safe routes to school. So, for example, if you're talking to a school district, they might be motivated by academic achievement, right? That's a huge one right now, just because people are talking a lot about learning loss, from remote learning. There are students who have, fallen behind. Can you tie safe routes to school into academic achievement? So saying that, kids who walk and bike to school or roll to school are, better focused, more prepared to learn. That could be a compelling reason for somebody to support safe routes to school. Attendance is another one, just making sure that there are students who are, in seats and on time, going to a school district and saying, giving kids the opportunity to, walk or bike or roll to school with their friends, can help increase attendance. Kids will want to, be able to, have that time with their friends before going into school. Also safe and healthy kids, reducing congestion around schools. Again, that's another big one that school districts might be thinking about right now, just based on a lot of school, school traffic these days. And, even things like reducing transportation costs. Okay, if we don't have to spend as much money on school buses, that reduces our transportation costs because kids are walking and biking and rolling to school. What can those other, funds be used for? So those might be some motivators on a school district level. Thinking about a county or a city level and what might motivate some of the decision makers there, something like safety. So just having better traffic safety and reducing the risk of serious injury or fatalities around school zones. That's a big one. Even something like economics, so, a lot of people are looking for neighborhoods that are, that are walkable and bikeable, and where you can, roll and kind of have everything right around you. Something like that might attract more, new residents or visitors to the city or county. There's there are economic benefits as well. Livable communities, same thing. People want to walk, people want to bike, people want to roll, people want green spaces to hang out, to recreate. That might be another motivator for a county or a city decision maker. Also the environment. So, reducing air pollution, reducing, greenhouse gas emissions. So getting cars and school buses off the road and getting more walking and biking and rolling to school will just make for cleaner air and a better climate. And also just overall community health. So having people who are being out and being physically active, students, families, school staff, just creates, helps make an overall healthier community. And then at the state level, so everything I just mentioned, could be a motivator for a state decision maker. So like I mentioned, the economy, health, safety, transportation, environment, education, even with the health point, mental health is a big one that people are talking about these days as well. So, giving people the opportunity to, be together and connect with one another, even just, being able to be outside and, clear your head for a few minutes as you're walking to school. That's something that can increase a student's, not only their physical health, but their mental health as well. So all of these things might be compelling for state policymakers as well. And again, it's really knowing, who the decision makers are and what they're motivated by. So I definitely suggest, trying to figure out who those decision makers are in your community and figuring out what motivates them. You might find that a city council member, is also an avid cyclist, and that might be, an in to safe routes to school advocacy. Or there might be somebody, who's really passionate about, cost savings and making it so that people don't have to spend, money on gas to drive their students to school. That could be an in. So a lot of this is just kind of figuring out, who you're working with and what they're driven by and what they care about. And the next step is really building your coalition. So I know that anybody who's worked in advocacy knows that it can kind of be hard to, go at all this alone, and having a team supporting you and working alongside you is really helpful in advancing your efforts and making change. So when thinking about, building a team or a coalition, in this case, why is that important to do? Why is working in coalition a good way of going about any kind of advocacy work, but especially for safe routes to school? So working in a coalition just means that, you're expanding that level of support, and, each member of the coalition will bring something to the table. So everybody will have their own area of expertise. They'll have their own, networks. They'll have their own, influence over different, over different areas. And they'll, just each bring something that's unique, that'll be helpful in the larger advocacy goal. You can also reach a broader constituency. So, if there's one person, it's just you. If you're working in a coalition of, 10 partners, let's say, then, your opportunities to reach a broader group of people, kind of expands exponentially, depending on how far out that network goes. It'll also help you to diversify your skill set. So advocacy takes a lot of work. There are a lot of different, moving pieces. There are people who might be writing things or talking to press or creating different things. And so, having people who are, kind of good at lots of different things, whether it's connecting with a school or, writing a press release or organizing a group of people, all those skills are really helpful when advocating for something. So make sure you have a diverse skill set as part of your coalition. It also ensures coordination. So instead of having a different, people working individually on the same thing, how can you bring all those people together and work as one, as opposed to dividing those efforts? And then lastly, it'll also maximize your efficiency and effectiveness. So again, working as a group and kind of coordinating efforts as opposed to everybody doing their own thing can just help make you get things done faster and probably better than having everybody working in their individual silos. And just thinking about who would be on your coalition, who to put on your team. So you might want to think about just, who you're currently connected to. So, if you have a PTA, if you're part of a PTA, if you have, other community groups that you partner with, if you have other, parents, caregivers, friends, neighbors, different local contacts, who can you bring in to your coalition, into your team? You can also think about, do those members represent diverse sectors, disciplines, expertise, and people? So, do you have people who work in education and public health and environment? Do you have people who are from, diverse backgrounds and who look like the community, the community members who you're working to serve? Who has a vested interest in this cause? So are there local bike advocates in your community, or people who like to bike, or people who, are really into the environment, or creating green spaces? Who are people who are really into, health initiatives? Who might already be, invested in something like Safe Routes to School, and how can you pull them into your coalition? Same thing with thinking about other organizations and people who are, great advocates. Is there a local, bike organization or walking group, or, another community group who can also be a really great advocate and help tell your story? Also think about who has relationships with students, with the students, with the schools, you all as, parents, caregivers, local advocates, you're probably already connected to your, to schools, which is awesome. It's always good to have those people, as part of your team. Who else can you also pull in? Sports coaches, after school providers, other people who might be, working in school communities. Also think about who has subject matter expertise. So if there's somebody who's, an expert on bike education, or who knows something about, infrastructure projects for schools, or even if there's just somebody who knows, how to lead a team well, bring that person in. And you can also think about who will be respected by elected officials, so kind of who has that pull or that weight in the community. I'd say both pull over elected officials, but also just like who has influence over the community in general. And those might just be like informal leaders. It could be a neighbor who everybody knows, but who everybody listens to because they know everything. So who are like both those, formal and informal leaders. And there's just a few others. I already mentioned subject area expertise, elected officials. And then just lastly, who has good relationships with organizations and advocates who might be in opposition. So people who would be against safe routes to school. You might find people who don't want, to have school zones be more walkable, bikeable, and rollable. So, if there are people who kind of, know those groups who might be a bit cautious or opposed, could they possibly, be in a part of your coalition to kind of help, be a liaison between two different opposing groups. And also just to us the knowledge and expertise to help guide the strategic actions of the campaign. So, who might be able to connect with local media, who might be able to, who's really good at, writing things or messaging things. How can you kind of pull together all of those different skill sets in order to, create the strongest, most effective team possible? And then just thinking specifically about who could be on your team. Anybody really, anybody who makes sense, I think should be on your team. So that can include parents, caregivers, community partners, elected officials, neighbors, school staff, even students. There have been a lot of really successful student advocacy efforts, around safe routes to school, around walking and biking and rolling, your public health partners, transportation partners. So there's a wide range of people who can be involved in safe routes to school, which is what makes the program so great, that it really is something that's for the whole community. So I'm going to stop here and pass it over to my colleague, Michelle, to talk a bit about crafting your message for Safe Routes to School.
Thanks, Kori. So now that you have your team, you've built this diverse coalition, you know what you're going to advocate for, you know what you want to do. Now you want to think about crafting your message. And of course, this is going to be specific to both what you're advocating for and also, the decision makers that you're trying to connect with and their interests and priorities, as Kori said. But one of the ways that one of the messages that we've used, especially coming out of the pandemic is that safe routes to school is an essential need for students and families. So I wanted to provide a couple of resources here that we have developed. And Kori, can you? Thank you. So we developed a number of safe routes back to school talking points that talk about the COVID-19 pandemic and the toll it's taken on our communities and kids, and how safe routes to school can be part of the solution as we're thinking about COVID recovery and pandemic recovery. So we know that the pandemic has had an impact on the health and academic performance of students, with isolation and remote learning happening. We know that the effects have not been equal across the board, and that low-income communities and communities of color have really held the most of the burden. And at the same time, we've seen spikes in traffic danger. So while safe routes to school isn't the solution for everything, it can be part of the solution as we think about COVID recovery. So on our talking points, we'll have all of this linked in the PowerPoint. We talk about all the benefits of safe routes to school and how walking and rolling in safe routes can help. All those things in terms of improving physical health, improving social and emotional health, lowering transportation and healthcare costs, reducing those, the tardiness and absences, and improving, academic performance, and improving safety. So as you're crafting your message, wanted to point you towards some resources where you can find data and information to include as you support your case. So in terms of the benefits of safe routes to school, Kori showed those infographics. We have a lot of these linked on our website. We have success stories, we have national highlights. These all have citations and data points in order to be able to show very specific numbers that you can share with your decision makers. And then in thinking in terms of what other information that might be specific to the concerns or challenges that you're looking to address in your community. Some places to look if you're looking for academic achievement information or information about attendance rates, go to your local school district. Your local or state health department would have all of the information about children's health, chronic disease rates, as well as things related to physical activity or physical inactivity, and air quality data. You might also look to your local medical center or hospital to get information on traffic injuries and fatalities, as well as more general community health data from within community assessments. If you're looking to provide more information about crash data, maybe identifying specific locations in the community where you'd like to see improvements, or make the case for why improvements should be made in specific neighborhoods. You can connect with your local transportation department. They'll often have local crash data, as well as information about the local road conditions. The state transportation department, TxDOT, has crash data as well. And then some of the metropolitan planning organizations or regional planning agencies also have crash data. And here you'll be able to provide, find information to include about injuries and fatalities, and especially looking at injuries and fatalities for those walking and biking. And you may be able to even get information about, student age populations walking and biking as well. And then finally, you don't need to use just quantitative data, but sometimes the stories of your students, your families, and your community members can be just as powerful, if not more, than having those data pieces. So really encourage you to think about doing walk audits, to have community members provide photos or videos and really share their experience walking and biking to school, and express their desires on what they would like to see to improve and to have safe routes to school. So also consider that there's different ways to deliver your message. You could either raise the issue publicly through print media, social media, events, word of mouth, but you can also directly connect with your decision makers, or both. So we're going to talk about some strategies around inviting decision makers and agency staff to events, but also think about opportunities to testify at a public hearing, a city council meeting, or a committee meeting, writing a letter or email and expressing your interest and concerns to a committee or an elected official or the public works or transportation staff, and then offering to meet with them. And as Kori said, there's a lot about Safe Routes to School that can appeal to different stakeholders and decision makers. And at the same time, there's really an opportunity to connect Safe Routes to School advocacy to other local community initiatives or things that you might be advocating for. So for example, there is a new infrastructure funding coming from the federal government. And with that new infrastructure funding becomes more opportunities for support for Safe Routes to School as part of, generally building the support for transportation and active transportation. I know there's a few folks on here who are coming from other areas of Texas, and we actually have a few other Texas examples on here. Be Well Acres Homes as an initiative in the Houston area. And they've connected Safe Routes to School to their local health and wellness initiatives. And we've also seen schools and school districts connect Safe Routes to School as a solution to that school bus shortage and traffic congestion. Also coming from the Houston area, from Baytown, they connected their Safe Routes to School initiative with also working on Safe Routes to Parks. So what benefits a school as a community destination, and the students and families attending the school can also be benefits for other community destinations and other community members. And then finally, connecting Safe Routes to School as part of your local equity and social justice initiatives, because Safe Routes to School is a way to address some of the inequities, especially around student health, around transportation and traffic safety. So quickly pause there for any questions. We can go into our last section.
Yeah, I don't see any yet, so we can keep going.
Okay. Actually, I think we have a poll. So we wanted to ask, what Safe Routes to School activities have you or your child participated in? It's multiple choice. There's a lot of different Safe Routes to School activities, or they might not even be advertised as Safe Routes to School activities, but things like walk and roll to school day or bike and roll to school day. It might be bike education or a bike skills course or pedestrian education, or a walking school bus or another walking program. So it looks like, I can end it and share the results. It looks like walk to school day is the most popular. That tends to be the most popular activity for community members to participate in, followed by some of the bike to school day, bike education, pedestrian education, or walking school bus programs. Great. Oops. So we say this because Safe Routes to School events provide a really great opportunity for advocacy. And one of the core components of Safe Routes to School is, providing those education and encouragement and engagement activities and events. And you can definitely use those to build excitement and to engage your community members, your students, and your families. But it's also a great opportunity to get in front of decision makers and to build their excitement and gain their support for Safe Routes to School. So first idea for a Safe Routes to School activity that could provide that opportunity to get in front of decision makers is walk and roll to school day. And this is observed every October, and it's a great attention grabber. It really is a way to celebrate and create visibility and buzz for walking and biking to school. And so this is something where it's an opportunity to be highlighted in the local press with your local newspapers or news station, and an opportunity to educate parents, school staff, and local elected officials about what the needs for safety and benefits are for children walking and biking to school. So this can really be a initial rallying cry and support generator, especially at the start of the school year. Similarly, Bike Enroll to School Day is observed every May, and another opportunity to have a large sort of gathering and celebration of biking to school, and invite your local decision makers, your local elected officials to participate as well. And the next idea is to do a safety awareness demonstration. And this is an example, I think, that Kori worked on, where they worked with the student safety patrols, community members, and crossing guards and arts partners to put together this event. It was actually organized by a neighborhood elected official. And so these demonstration events or pop-up projects can really be used to raise visibility and start conversations about the importance of safe walking and biking infrastructure. It can point out areas that have challenges and need improvements. It also can show folks, what's the potential for change and how can things be better. So this can be an advocacy tool and an educational event, again, to invite the public and your decision makers to see things on the ground and to recruit partners and catch the attention of local news outlets. And to talk about what the changes need to be and could be. Walk audits are a staple of Safe Routes to School programs, and these are really gathering community members and stakeholders to assess the area around a school and along walking and biking routes to identify the barriers or challenges and potential solutions. So they can be used to recruit volunteers in your local community. They can be used to share, with news outlets, what are the challenges. They're also a great activity to invite your elected officials, as well as the local city or county staff who's in charge of roads, to walk the area with community members and to hear their concerns firsthand, and to talk about what solutions could be out there. And then finally, definitely think about promoting Safe Routes to School at related events. So these could be things like community health fairs, or school events, or anything where there's an opportunity to get in front of community members and in front of other potential partners to talk about what are the benefits of Safe Routes to School and how can those benefits be sort of shared priorities. And, given today and our reliance on social media contests are also a great opportunity. And popular approaches for Safe Routes to School advocacy can include things like having community members submit, the best or the worst bus stop or infrastructure. Or photos of kids and families, walking and biking. Maybe it's on one of those special walk to school or bike to school days. And this is a way to, quickly spread the word and to get the news out in your community, to reach a lot of folks, and oftentimes, creates a lot of buzz as things go viral. And then finally, wanted to cover a little bit on school district policies, knowing that this is probably a group that might be interested in incorporating Safe Routes to School into a district wellness policy, or creating a standalone Safe Routes to School policy. So we have a free online tool that was developed between our organization and Change Lab Solutions that essentially allows you to sort of build your own Safe Routes to School policy and sort of tailor it to your local needs. And sort of similar to some of the things that Karen showed earlier, it's organized in sort of beginner, intermediate, and advanced policies to sort of meet where your district and your community might be at. And on the next slide, we have some of the beginner policies. And the district workbook, I use it both for talking about and thinking about what could be included in a policy, but also like, what are the different components of safe routes to school and what could a community do? So a lot of these beginner policies cover all the wide range of components of safe routes to school. So they can include things like generally supporting walking and biking or active transportation in your community, specifically supporting a named program, Safe Routes to School, programs or policies around minimizing driving, creating school teams or a task force to work on safe routes to school, policies to promote or include traffic safety education, or to create some of these opportunities like walking school buses and bike trains, and having those like regular events every year can all be incorporated into your district safe routes to school or wellness policy as well. These last few slides, primarily put these in there really just to let everyone know what resources we have available on our website, and encourage you to take a look at these afterwards. We have a lot of resources on working with different stakeholder groups and decision makers. So they go through a lot of the same information that Kori covered in terms of what are the common motivators, how might you craft your message, or how to understand, the inner workings of some of these agencies that could be very bureaucratic, and who you want to connect with and how to connect with them. So we have resources on working with school districts, so both in terms of school boards as well as superintendents, and including safe routes to school, specifically in district policies. I know that we've covered a lot today on focusing on local district and local city and county advocacy. But on the next slide, we do have some resources about state level advocacy. And sort of, there's the ability to have these parallel strategies to encourage more resources for safe walking and biking to school from the state DOT and other, state agencies. And then we have a number of resources around safe routes to school policies, staffing, funding, equity. And then finally, we have a series of resources really intended for folks to understand the different stakeholders. So what's the role of school boards and principals in safe routes to school? How does the student transportation department intersect with safe routes to school? What's the role of your municipal, your city or county transportation department? What's the role of your regional government agency, et cetera. And then we also have companion primers for these folks, for them to understand what is safe routes to school, and why it is important for them to be included in the conversations around safe routes to school and why they should care. So these are all linked. So when you get the slides, you can go on our website and poke around and learn more. So with that, any additional questions?
We have a quiet group. I think they're overwhelmed.
It's a lot. There's a lot. Yeah, there's a lot to cover. a lot to mull over.
It's the most comprehensive information. I mean, I visited a lot of websites in my work with school health, and I have never had such cohesive information that goes step by step that anyone who's really concerned about children walking, biking, or just traffic can go to your website and find what they need to share their story. So it's just amazing. But are there any questions out there for our group? I know y'all did a fabulous job, and you went through a lot of information very quickly.
Yeah.
I'm amazed.
We told you, Michelle.
And our contact information is also here if you ever just want to reach out directly about a resource, or if you have a question. We get people reaching out all the time about the different concerns in their communities, or people who want to start programs or trying to figure out how to contact the right person. So you can always go on our website or also just email us, and we're happy to help out in that way as well.
Our work in El Paso has been enhanced incredibly by the relationship we have with y'all and the direction that you've shared with us. So thank you for sharing more with everyone else. I mean, it's pretty comprehensive. And I think I've heard a lot of the same takeaways from all of us today. Know your audience. I mean, all the information that you've shared for all the different audiences make it abundantly clear that you can't just take in the same message. You have to make it fit who you're talking to. If it's school administrators, it would be academics. If it's parents, it's child safety. Same thing with PTA, same thing with the group we had this morning around vaping. Finding the information that's going to resonate with the people that you're talking to. Don't do it by yourself. Join a coalition, join a school health advisory council, join a PTA. All of these groups can help advocate and make it a stronger ask and a stronger set of advocacy. Engaging parents. I mean, we talked about it from SHAC, we talked about it from PTA, we've talked about it through Safe Routes. The parents are the key to a lot of change. They can do so much. Districts' hands are tied a lot of times, and school teachers can't do things that parents can do. So engaging those parents and giving them a voice, either as PTA, as SHAC, or as parents just wanting to make change happen around something like Safe Routes, are all important. And I want to say, in identifying the issues that are most important to your community. We've been working in El Paso for 4 years. And when we started, we asked the community what was most important to them. And there had been several fatalities that year, and Safe Routes jumped to the top of the list, along with recess, kids getting recess in school, having healthy school meals, and then community partners being able to work with schools through joint use agreements to provide programs and services. And so we have focused on those areas, and we've made some good progress with engaging parents and getting them involved in a lot of the work we're doing there. So a lot of things too, I think one of the other things that I think is important is it came through a couple of times, was making it personal, not just going in and showing statistics. It is scary when you see the numbers on vaping. It is scary to see, fatalities, but telling a story like Karen mentioned from PTA of what, your family's experience is, or what your child's experience is, personalizing it, or identifying a school board member who has that issue or has dealt with that issue. I've seen legislation pass simply because a legislator had a family member that was autistic, and they wanted that family member to be able to get access to special schooling. So all of a sudden, they were no longer a public education advocate. They were a, voucher advocate. So, knowing what you're trying to accomplish and trying to make it something that people can relate to across the board is really important. Anybody have any comments or questions or anything they'd like to share about today's sessions? I hope you're leaving feeling that you can be a stronger advocate for the things that matter most to you, and that you can find the group that will help you have a voice, because I think there's lots of really good groups out there that we can all be a part of. I do have, I didn't throw our slides up, but we do have resources that we will share as part of our slides. We also have a lot of webinars that are on YouTube, and we will share that link with you on different topics, from recess to engaging parents to social emotional health. So we will share that information with you, as well as how you could join the SHAC network and hopefully get more engaged with the SHAC in your community. So any parting remarks from my wonderful presenters? No? Y'all are so, y'all.
I want to say thank you again for having us, and always thank you to Action for Healthy Kids for just providing these wonderful avenues for communication.
Well, we appreciate y'all being willing to join us, and I thank the virtual universe for making these opportunities available. A lot, sometimes it would be challenging to get people from National Safe Routes to be here, but thank you to Zoom for allowing us to have access to you all. So y'all have a great rest of your week, and we will be sending out a link with to the video, as well as a PDF file with all of the slides. And if you have any questions, you can certainly reach out to our presenters if it's specific to what they shared, or you can reach out to me, and we will definitely get you information and keep you going forward. So thank you all, and have a great rest of your week. Bye.
Thanks, everyone.
Thank you.
Thank you, Michelle.